Hello class, today I will be teaching about wound healing and this class is for BSc second year pathology. So before going to wound healing, let us see what is the meaning of healing. Okay, so healing is the body's response, to any injury in an attempt to restore normal structure and function. So if there's any injury in a body, so the first thing is that it will respond, our body will respond to that injury and it will try to bring back into the normal function or to the normal stage. So that is healing. So if, for example, if we have any injury, if we fall or because of any activity, if we fall and then we get an injury on the knees or injury in the hands and face, then what happens is our body will respond to that injury, and it will try to bring back into the normal stage or to the normal structure and function. So this is nothing but healing. So this is a simple definition of healing. Next, so healing, there are two processes of healing. Number one is regeneration. Regeneration means to regenerate the tissues, to regenerate the cells and to come back into the normal state. And last is repair. Repair means to fix something by to fix that injured portion. So that is repair. For example, repair of a car or repair of a bicycle or repair of a mobile repair. So if there's any, for example, like a mobile repair. So if mistakenly if the mobile falls on the ground, there's a crack or there's the side buttons are not working properly, then you have to send it for mobile repair. So in the same way only, if the body is having any injury, because of any gunshot or knife stabbing or any falls, so what happens is the body will have some injuries and you will have to go for the repair system. So there are two healing process. One is regeneration and one is repair. So let us see what is regeneration all about. Regeneration is when healing takes place by proliferation of parenchymal cells. So in regeneration, how it regenerates it is because of proliferation or growing, slowly growing of these parenchymal cells, and it results in complete restoration of the original tissue. So there is restoration, or there is there will be like a normal process. So regeneration, remember that it takes place, healing takes place by what? By proliferation of parenchymal cells, and this results to a complete restoration of the original tissues. Next, the goal of all surgical procedures, whenever patient is going for any surgery, so the goal of the surgical procedures should be regeneration, which returns the tissues to the normal structure and function. So that is the main reason for any surgery being done. So why we tell the patient to go for a surgery or advise the patient for any surgery? Why? So that there will be regeneration and the person can, so that the tissues of that particular part will come back to its normal structure and function. So this is regeneration. Next is repair. Repair is, like I said, for example, like a mobile phone I gave you. So it is a healing outcome in which the tissues do not return to the normal architecture and function. So like I said, suppose if you mistakenly if your cell phone falls on the ground, there will be a crack on the screen. So what do? You have to go and give it to the repair shop, and what will they do? They will remove the cover of the screen, and they will provide a new screen or a glass, or a screen cover. So that is repair. So it is a healing outcome in which the tissues do not return. So the broken glass or the broken screen cover will not come back to its normal position, but we will try to provide a new, we will insert a new screen cover or a new any repair or any repairing artificial equipment or a instrument. So repair typically results in the formation of a scar tissue. Okay, so this is regeneration and repair. So I hope this is clear about the two processes of wound healing. So let us go to the stages of wound healing. What are the stages of wound healing? There are 5 stages. One is stage of inflammation, stage of granulation, tissue formation and organization, stage of epithelialization, stage of scar formation and reabsorption, and stage of maturation. So these are the 5 stages of wound healing. Okay, so there will be inflammation. The second stage is the granulated tissue will be formed and it will be organized. Then there will be epithelialization, that the epithelial cells will be active. Then there will be a scar formation and there will be resorption, and the skin will be mature. So now coming to the phases of wound healing. So for soft tissue wound healing, okay, so there are three phases. One is inflammatory phase, second is proliferative phase, and maturation phase. Okay, so in inflammatory phase, it can be divided into 3 stages: clot formation, early inflammation, and late inflammation. Okay, so if there's any injury to a part of the body, okay, so the first phase will be the inflammation phase. Okay, so the inflammatory phase is further divided into clot formation, early inflammation, and late inflammation. So let us see what are the stages of the inflammatory phase. So like I said, first is the clot formation. So whenever whenever there's an injury into the body part or to a finger, what happens is there will be bleeding. Okay, so in order to stop the bleeding, clot formation will start. So it begins with 3 events. First, blood vessel contraction initiated by platelet degranulation of serotonin. Okay, so there will be contraction of the blood vessels because of the serotonin. Okay, this serotonin will help in the contraction of the blood vessels, and it will increase the permeability of the vessels, therefore allowing a protein-rich exudate to enter the wound site. Okay, so what happens is, first there will be contraction, okay, in the blood vessels. How are these blood vessels contracted? Because of serotonin. Okay, and this serotonin, what happens? It will try to contract the blood vessels, and because the vessels are contract, they will increase, in the permeability of the vessels will increase. That will be meaning that they will allow the exudate or the protein-rich exudate to enter into the wound site. Okay, so they will allow the exudate from outside to enter into the wound site. So that is the first event. Second is a platelet plug formation. Okay, so all the platelets, wherever the platelets are, they will try to surround the injured site. Okay, wherever there's an injury, they will try to come together, and they will try to surround the tissue. They surround the injured site. So that is a platelet plug formation. And third is activation of extrinsic and intrinsic clotting mechanisms. So in class 12, okay, science, maybe you have learned about intrinsic and extrinsic mechanism of clotting. Okay, so there are 12 factors which help in the clotting process, so that the blood will be coagulated. Okay, clotting of the blood will take place. Therefore, the bleeding will stop. So there are 3 events. Okay, in clot formation, first is there will be contraction of the blood vessels with the help of serotonin. Because of contraction of the blood vessels will occur, this will lead to increase in permeability of the blood vessels, meaning that it will allow the rich exudate from outside to enter into the wound site, okay, wherever there is injured site. Next, the second event is platelets. Platelets will try to, they will try to form together, and they will surround the injured site or the wound site. Third is the clotting factors will be activated. Okay, the intrinsic and extrinsic clotting mechanism will be activated, and clotting of the blood will take place. So there will be no bleeding. Okay, so the bleeding will stop. So these events stabilize hemostasis it begins production of chemoattractants and initiate the process of wound decontamination. And this results in the formulation of coagulum. Okay, so there will be coagulation process. So the blood, so eventually in clot formation, the blood will be coagulated and there will be no bleeding. Next is the second stage, that is early inflammation. In early inflammation, it is characterized by production of polymorphonuclear neutrophils, that is PMNs. Okay, polymorphonuclear neutrophils. So these neutrophils, okay, these are WBCs, right? So they will be produced and they will enter the wound site within 6 hours of clot stabilization. So within 6 hours, these neutrophils, PMNs, or polymorphonuclear neutrophils, they will move to the injured site or the wound site within 6 hours. Then the number of PMNs increases, peaking at about 24 to 48 hours after the injury. So after the injury, okay, these PMNs, they will increase in the number. Okay, the neutrophils will increase in the number of neutrophils, and they will be very high during the period of 24 to 48 hours after injury. Next is third stage is the late inflammation. Late inflammation, it is characterized by the presence of macrophages. Okay, so we have learned about macrophages. These macrophages, what do? They try to engulf the bacteria and they try to kill. Okay, so I will tell you what the functions of macrophages are. So in late inflammation, there will be presence of macrophages. It reaches the peak concentration by 3rd or 4th day. Okay, so on the 3rd or 4th day, okay, these macrophages will be very, very high. Okay, and they will have longer life than PMNs, or they will have longer life than polymorphonuclear neutrophils, and they remain in the wound healing. They will stay in the wound till the healing is complete. Okay, so these macrophages are very, very important because they will help in the wound healing. So macrophages are more bioactive than PMNs. Okay. So when you compare macrophages and neutrophils, the more active or the more bioactive is the macrophages as compared to the neutrophils. Okay, so because of the high active or the bioactive of macrophages, they will lead to the initiation of proliferative phase of wound healing. Okay. So next, like I said, the functions of macrophages. Macrophages are very, very important because they play a very important role in wound healing. So these are the functions. Number one is they help in wound decontamination. Okay, that is phagocytosis. They engulf the microorganisms, they engulf the bacteria, and they engulf the tissue debris. Whatever the surrounding tissues is, they will try to eat it up. Next, ingestion and processing of antigens for presentation to lymphocytes. So this is another function of macrophages. And third is it helps in the regulation of wound healing. So like I said, macrophages are very important for wound healing. So we have done with the inflammatory phase. Okay, so like I said, inflammatory phase is further divided into clot formation. Okay, second is early inflammation, where the polymorphonuclear neutrophils are very active, and late inflammation where the macrophages are very active and during this stage. Okay, now coming to proliferative phase, that is the second phase after inflammation. Next, in proliferative phase, it is characterized by formation of granulation tissues in the wound. Okay, so in proliferative phase, there is granulation tissue formation in the wound. Okay, so after the macrophages when the macrophages are very active and they have done their work, okay, so then the granulation tissues will be formed, and the two key cell types are present in this phase, that is the fibroblasts and the endothelial cells. So these two keys, that is the fibroblasts and the endothelial cells, will be very, very active during the proliferative phase. These two things will help in the formation of the granulation tissue. So I will show you a picture of the granulation tissue. Okay, so as you can see this, This meaning, so you can see this pink color. Okay, so this is the meaning that it is healing. Okay, the skin is healing. So granulation tissue, it is a fragile structure composed of extracellular matrix. So this granulation tissue, okay, it is composed of extracellular matrix of fibrin. Fibrin helps in the clotting. Fibronectin, glycose, aminoglycans, proliferating endothelial cells, new capillaries, and fibroblasts. They are mixed with inflammatory macrophages and lymphocytes. So these are the components of granulation tissue. These are the components that makes up the granulation tissue. Okay, so what are they? They are fibrin, fibronectin, glycose aminoglycans, then the proliferating endothelial cells, okay, then the new capillaries, fibroblasts, which are mixed with macrophages and lymphocytes. So these are the components of a granulation tissue. So this is very important in proliferative phase. Why? Because here the granulation tissue is being formed, right? It is being formed in the wound. Next, the epithelial cells are active during this phase and they are responsible for the initial wound closure. So like I said, fibroblasts and epithelial cells are very, very important in this phase. Okay, they are very active. Next, the GTR procedures are based on control of the epithelial cell growth rate during this phase. So this is all about proliferative phase. Next, the last is maturation phase. So we have done with inflammatory phase, we have done with proliferative phase, and now coming to the last is the maturation phase. So this phase begins 5 to 7 days after the injury. Okay, there is conversion of granulation tissue to fibrous connective tissue. So in maturation phase, what gets converted to what? Granulation tissue. Okay, the granulation tissue like I've shown here. Okay. This granulation tissue is being converted to fibrous connective tissue, okay, and it decreases the parallelism of collagen to the plane of the wound. Okay, so it decreases the collagen, the collagen fibers to the plane of the wound. Next, maturation of the epithelial layers quickly follows following the formation of the epithelial seal. So in maturation phase also the epithelial layers, it forms quickly, okay, it matures quickly after the formation of the epithelial seal. Okay, so this is maturation phase. And the scar strength is 3% in 1 week, okay, 20% in 3 weeks, and 80% in 12 weeks. So we can see in so when we have injuries in our body, okay, there will be scar formation, right? Okay, so that is the last product of the stages of wound healing. So the scar strength is 3%. Okay, that is the strength of the scar in 1 week. 20% is the strength of the scar in 3 weeks, and 80% is the strength of the scar in 12 weeks. So that is about the phases of wound healing. Okay, so we have done with inflammatory phase, we have done with proliferative phase, and we have done with maturation phase. Now coming to the factors. Okay, so what are the factors which affects the wound healing? So there are local factors like infection. So if there's any infection apart from the wound, then that will decrease the wound healing. Presence of necrotic tissue and foreign bodies. So if there's any foreign bodies, or if there's any necrosis, then that also will decrease the process of wound healing. So the wound healing will take time. Next, poor blood supply. If there's inadequate blood supply to the wound, then that also will slow the wound healing. Venous or lymph stasis. There is obstruction or stagnant of the veins and the lymph. Okay, then tissue tension, hematoma. Okay, and large defect of or poor apposition. So these factors will affect the wound healing. They will decrease the wound healing. Next, recurrent trauma. If there's any trauma, okay, suppose there's an injury, okay, and after a few days there will be another injury on the same site, then that also can decrease the wound healing. Next, X-ray irradiated area. If X-rays are being exposed to that wound healing also, then that also can decrease the wound healing. Site of the wound. Wound over the joints and back has poor healing. So site of the wound also depends. Okay, whichever site of the body, wherever the wound is present, that also has an impact on wound healing. And last is diseases, secondary diseases or underlying disease like osteomyelitis and malignancy. That also can delay the wound healing. Next, general factors. So we are done with the local factors. Now coming to the general factors. The general factors are age. Okay, age, obesity, smoking. Increase of age, obesity if the patient is too obese, and smoking. Smoking is also one of the triggering factors for wound healing. Then malnutrition. If a patient is not taking proper nutrition, then also wound healing will not take place. It will be very slow. Zinc, copper. Next, vitamin deficiency. Lack of vitamin C, lack of vitamin A in the body also will lead to wound healing delay. Anemia, okay, loss of blood in the body. This also can lead to delay wound healing. Malignancy, jaundice, diabetes, HIV and immunosuppressive disease, steroids and cytotoxic drugs. These also are some of the factors for decreasing the wound healing process. So that we have come to the end of the topic today. Okay, so we have done about the definition of wound healing. Okay, what are the stages of wound healing? There are 5 stages: stages of inflammation, stages of granulation, tissue formation, stages of epithelialization, stages of scar formation, and stages of maturation. And we have also studied about the phases of wound healing. Phases of wound healing, there are 3, that is inflammatory phase, proliferative phase, and maturation phase. And we have done in details about these phases. So, and also we have studied about the factors affecting the wound healing. So I hope you have understood by this. Thank you.